Hello, it's Dr. Joseph Aiello again from San Diego Center for Integrative Medicine, and today I'm in our IV room to talk to you about the power of natural therapies and what we can do for you at the clinic. This is really important because this is what we've been striving to do for patients for a long time, and now I have a perfect example of the things that we can do for people. Pay attention because it's very, very important. We had a patient come in who's 50 years old, a male, who had check and did all of his blood work. We found that he had high blood pressure, he was overweight by about 100 pounds, and he had borderline diabetes along with low testosterone. So I presented this to him and told him that there are several ways that we can deal with this, and one way obviously is the traditional medical way, where we can throw a lot of medications at somebody, and he was very hesitant to do that, and I don't like to do that anyways. And the other way is to actually treat this in a natural way and the proper way, which is through nutrition and diet and exercise and weight loss. And the patient was very responsive to this and very excited. So he ended up seeing our nutritionist, ended up going through the nutritional regimen that we have, and we then tested his blood about 3 months later. He had lost 49 pounds. He's feeling much better. He has more energy. He's able to exercise. He has good libido. He's on testosterone, and his testosterone has gone from the low 200s now to 650. But more importantly is his blood pressure has now gone down from 149 systolic to 112. Along with the weight loss, his cholesterol and his sugars have gone down, and I wanted to show you some of the lab work to give you an idea of the power of what we can do with just natural means and just somebody taking responsibility for their health and actually not eating junk food and doing the proper thing with diet and exercise and weight loss. And I want to show you here. 3 months ago, his total cholesterol was 165, which wasn't bad, but his small particles, which are the problem, those were very high, and those are the ones that are atherogenic. So here his total cholesterol went down to 140, his triglycerides went down from 330 to 134, and the small particles have actually decreased down into a more normal range. His CRP has stayed elevated, but that's because he does have some back issues, and I think those are inflammatory and inflaming things. He also had very high uric acid levels, which is related to gout and also to metabolic syndrome. This patient was in frank metabolic syndrome along with diabetes. His uric acid went from 9.2 down to 7.0 with the dietary modifications, and that's what we want. Evidence that the metabolic syndrome is getting better. Now, this is really critical because this is a patient that had diabetes, and now with the nutritional regimen that we have him on, his sugar has gone down from 123 to 93. His long-term sugar, the glycohemoglobin, went from 6.4 to 5.2, and his average sugar went from 137 to 102. Those are excellent numbers now. That's basically he is not diabetic anymore based on dietary regimen. But real critically, if you look down here, we measure everything when we do these labs, and we were looking at his insulin levels. His insulin was 110, and that should be more around 15 or less. This was terrible. This is definitely a problem with obesity and the diabetes and just poor health. After he went through our dietary program, his insulin dropped down to 12. And his proinsulin, the pre-insulin, went from 148 to 11. So you can see this patient has done very well, but like our nutritionist says, 80% of the program is the patients actually doing the work. We're here to present what the patients can do and help themselves with, and that's about 20% of it. The patients need to take control and take responsibility. And if you're willing to, and you're willing to do it, you can actually help yourself in a dramatic way to improve your health and your longevity and live another 50 years with good health and good activity and no medicines. So thank you for listening in. I hope this helps and encourages some people that there is hope and things can be reversed. And come back and see us at San Diego Center for Integrative Medicine. We're always here for you.